joining us now, Dr. Katie Warren. Dr. Warren, Stroke Walk. This is an exciting thing, all these people coming out.
Absolutely. Great turnout this year. The weather is certainly better as well, so that helps get everybody out.
Okay, let's talk about stroke for a second. So I know in the warm-up you told people the FAST. Go over that one time if you would.
All right, so F is for face. So that's important because what you want to have somebody do is smile, or say, show me your teeth is the other way we do it, and you want to make sure that both sides of their face come up equally.
I mean, it's really not going to happen on one side, it's not going to move.
It might be flatter or maybe not as strong. Sometimes it's not completely,
but
the
other side just not going to be that same smile
Exactly,
on the other side.
exactly. Okay. And that's on the lower face. It actually doesn't affect the upper part of the face, so that's an interesting thing that we can pick up on. That's actually how we tell the difference between a stroke and a Bell's palsy. Okay. So then you got your A, that's for arms, and what you want to have someone do is hold up both arms next to each other and see if one of them starts to fall down or drift. You can also do that with legs, but that didn't fit into the acronym.
So now they might pick up their arm, but it's not going to stay.
Correct, and or they may not be able to pick it up at all.
Okay.
Yeah, and then you can also like grip your fingers. If the hands are weak, you can tell the difference there as well. And then the S is for speech. That's to have someone say a phrase or answer a question and see if the words that they're saying are the correct words, or if they're the correct words, do they sound funny? Because there's two different kinds of speech changes that we can see with a stroke. And then T is for time, and that is making note of the time that someone's symptoms start. The reason that's so important is because we only have 3 hours from the time someone's symptoms start to give them the medicine that we can use to stop a stroke in its tracks. So if we don't know the time it started, we always err on the side of caution and actually don't use the medication because the risks can outweigh the benefits in that case. If someone goes to bed normal and wakes up with a stroke, we also don't know when it started. So that there's some caveats there, but generally speaking, if someone is awake and aware and can tell exactly when it started, we have a lot of options.
Let me tell you a scenario that actually happened with a friend. Not feeling well, and some of the symptoms you just described were happening. I'm going to go lay down for a while and see if this gets better. What do you say with that?
Probably not a great idea. Definitely better to get checked out sooner rather than later, and err on the side of caution again. It's better to know for sure, but there are certainly cases where it's not a stroke, and I can see someone not being sure, but it's definitely better to get checked out because if we miss that window, there's not actually much we can do for a stroke that's ongoing at that time. So 4 hours or later, there's not much we can do besides actually physical therapy to teach the muscles what to do again that have been affected.
So the arm, the face, all that kind of stuff, that's all kind of short. Are there things that are maybe weeks ahead of time or months ahead of time that are little small things to watch out for?
There are not ahead of time any symptoms that anyone would notice because it is something that happens within seconds. So you can't tell ahead of time. However, there are other things that people should monitor for, which is we call risk factors, and that is things like diabetes, high blood pressure, and high cholesterol. And then we also educate about not smoking. All of those problems that people might have in their medical history can make a stroke happen and potentially make it worse when it does happen.
You were leading me right to my next question. What can I do up front to sort of head this off or make it so it never doesn't happen?
Right. So certainly not smoking is the biggest thing that someone has control over. And then beyond that, some of the other issues are not necessarily under your control, but if you have diabetes, it's making sure that you follow the diet recommendations from your doctor, take the medication as prescribed, and make sure that you're checking those sugars regularly at home and with your doctor. With high blood pressure, same thing. Sometimes it's out of your control, but taking your medications regularly to make sure that it's staying in the range we need it. And then cholesterol as well. Oftentimes that can be genetic, but it can be modified by diet. If it is something that is higher than a certain number, we prescribe medication for that to try to bring it down. With the intention of having all of those risk factors under control, we can certainly prevent strokes from happening.
So a stroke, it's in essence like a heart attack, but it affects your brain rather than your heart, right? So
exactly
are there dietary things to be watching out for?
Absolutely. So same thing. When you have a high fat, high sugar diet, those can directly affect diabetes, high cholesterol, and high blood pressure. So eating, smart, exercising, things like that. Same thing that you would do to prevent a heart attack.
So a lot of folks came out for the walk today, and you know, are they getting in a huge walk and they're going to get good exercise? Maybe a little bit, but it's exciting to see this many people interested in the topic.
Absolutely, yeah. And this is, it's great exercise. Probably not quite enough to prevent a stroke, but we're glad to see everybody out here active.
So just kind of in summation, okay, so do I need to I go to see my regular family doctor once a year, and should I be doing something in addition to that to head this off?
Not really. Usually, if you're confident in your family doctor and comfortable in talking about these issues, and make sure that those kind of things are being checked regularly, and that the medications you're taking are doing what they're supposed to do. But there's not really any other testing we can do ahead of time to predict this. There's no other doctor really that you need to see ahead of time. Oftentimes when someone has those kind of medical conditions, they take something like a baby aspirin every day. So we know that can actually help prevent stroke, but I don't routinely say everyone should take that because there are risks with aspirin also. And so you can't just take it for prevention, but if you have the need for it, that is a good way to prevent a stroke as well.
I think I'm allowed to ask one dumb question per interview, so
Absolutely.
Let me throw you the dumb question. Okay, so maybe I'm having some of the symptoms you described. Do I call an ambulance? Do I drive myself to the hospital? So to me, it's like, now this is just me, I would want to drive myself, but that's probably a bad idea.
It is because you don't know what could happen next. So you could be feeling okay, maybe a little numbness, the words aren't coming out quite right, but you feel strong and capable of driving, but what if in 30 seconds that changes and you crash? Plus, depending on traffic and things, it could take you longer to get to the hospital, whereas an ambulance, of course, has a little heads up there. So definitely call 911. The other reason why that's important is because the ambulance, the EMT, will know which hospital is capable of giving the medicine. Not every hospital actually has that in stock. So they have to be a stroke center, which Meadville Medical Center is. So that's another important reason to get them involved.
I hear announced over the speaker system at the hospital from time to time, neuro alert. What's that mean? What goes on whenever that's announced?
Yep, so that is when someone in the hospital, whether they're in the emergency department or on the floor, is having a symptom that looks like a stroke. And the reason that they make that announcement is that so everyone on the stroke team can rapidly go to the bedside of that patient, including a phlebotomist to draw labs, the technician that runs the CAT scan machine, make sure that the CAT scanner is open immediately, because that's the first test we have to do. There's a nurse from the ICU that's very well trained in stroke assessment and treatment. They also will have a physician will be there, whether it's the hospitalist, the internal medicine doctor, or the neurologist. We also have a stroke coordinator. That's a nurse that manages all of our stroke patients' education and making sure that we're doing all of the right things from a standard of care perspective for every stroke patient, that we meet that criteria. That's the standard of care. So we all kind of rush in and bombard the patient, make sure that we get that information right away and make sure they get the right treatment as soon as possible.
Well, did we miss anything? We talked about a lot of stuff.
I don't think so. I think we covered it all.
Dr. Katie Warren, thank you very much.
Thank you very much.
Well, joining us now, Shelly Wise, the stroke coordinator at Meadville Medical Center. So tell us what your job is.
Well, I do community education. That's one of the things that I do. And I work with other caregivers in the hospital to make sure that our patients get the best stroke care.
So let me ask you what happens. Okay, we talked with Dr. Warren a minute ago about all the warning signs and what to do if those things come along or whatever. Now, what happens when you get to the hospital?
So the ER doctor will evaluate you, and there's certain treatments that are limited by time. So if you come within a couple hours, then you could be treated with a medication called TPA. And then also, we don't have the capabilities to do something called endovascular intervention, but they do those for certain patients also up to 12 hours, sometimes even longer, up to 24 hours after the time that symptoms start. So it's important to get there as soon as the symptoms start, because if you are going to be a candidate for treatment, that treatment window is limited.
So the TPA, that's what people refer to as the clot buster, right? So talk about that for a sec.
So it's a medication that does just that. It just breaks up the clot.
So is that, now, here's me. Now, okay, now that clot was a big clot and it was maybe in my neck someplace or closer to my...
It can be in the neck, but it
now,
can
if we made little,
into the brain.
If we made little ones, is that going to cause problems someplace else?
If you made little clots? Oh yeah, if you could have multiple strokes at once if you showered. They call it showered strokes.
So the clot buster could help all of that.
Yes.
So now there's another kind of stroke too that's possibly related to like a blood vessel breaking, right? Now, what do we do about that one?
That's hemorrhagic stroke. We transfer those patients, and if they need neurosurgery, they go to a hospital that has those services.
Okay. So make the sales pitch to folks to what to be doing to be aware and to be paying attention to this, and your family member and your loved one and a lot. Make the sales pitch.
So don't try to diagnose the person yourself. Get to the hospital as soon as you can and let the doctors diagnose the problem, because there are certain things that mimic stroke, like low blood sugar, something called Bell's palsy, other different viruses and things like that can cause the similar symptoms. But you don't want to try to convince yourself that it's that or it's stroke. Just let the doctors do that because of that time window for treatment.
So I heard the count. I think they said 187 or 188 people out today. That's got to be exciting to you to have that many people be interested in this topic. For
sure, yeah.
I'm assuming there's a couple things. One, maybe they've got a family member or loved one or coworker or whatever that's been through this, and that's like, holy mackerel, that's a real thing, you know. But maybe not too. Maybe it's folks that are just interested. What do you think?
I think that it is affecting people. Every year, 800,000 people have a stroke in the U.S., and it is the 5th leading cause of death in the U.S., so I think it is affecting people. And I'm sure that's where we get the majority of our participants, is because it has affected them in some way, whether it's a neighbor, coworker, friend, family member.
So be aware of the FAST, right? And yourself, your loved ones, your coworkers, all that kind of stuff. I remember maybe it was even you and I did this interview a number of years ago, and we had a gentleman who had that at work, and coworkers recognized the things coming along.
And that does happen. I was actually just at a stroke conference, and one of the guest speakers was a stroke survivor who was an ER physician herself.
Wow.
And walked into the ER for her shift and started slurring her speech, and ultimately she did end up getting the TPA, and she's had a full recovery now. But yeah, it can happen to anyone. It is not limited to the elderly. Now, they are at higher risk for stroke, but even babies can have strokes, believe it or not.
Wow. What's the chance that I'm going to be back 100% after? I mean, if we catch it soon?
The sooner you get treatment, the better your chances are of doing that. I don't know of any particular statistic or anyone that could tell you exactly what your chances are of improving, but I do know your chances are going to be better the sooner you get treatment. Every minute that stroke goes untreated, millions and billions of brain cells are dying.
Wow. Well, Shelly, thank you very much for being with us.
Thank you.